There are lots of people dying now from air pollution, and we just don't realize it because it's all around. And the same with climate change. And we know how the bacteria or virus spreads. Air pollution and climate are more nebulous. You kind of have to piece together a lot of not so obvious things like stronger hurricanes, more heat illness. So many of the heart attacks and strokes and respiratory events that hospitals are dealing with every day are because there's air pollution in the air, damaging kids' lungs. It's our duty as a society to look out for our children, and we need to help them now by keeping the air cleaner and preventing climate change from getting any worse than it is. It just gives me hope to be talking to doctors about air pollution and climate. We need to have data-driven policy, but we need to have stories that we can connect to inside at a human level. We can fix this.
The inspiration that most of us went into medicine was an interest in science, the natural science, and the application of that knowledge to improving human health. Well, the science of climatic change is unambiguous at this point in time. There's really no real doubt about the adverse effects. We see the individuals, we bear witness to the suffering that's occurring as a result of this. So it gets back to the storytelling. We're able to give some of these stories that others perhaps can't. I think it is our obligation to tell these stories. We've identified the problem, we know what it is, we know what the source is, we know how to measure it. I sort of see this as a great opportunity for myself and future generations of physicians to participate in this global effort. We have the reason to be inspired.
So much focus, I think, more recently has been trying to understand that those that we know what we need to do, why aren't we making them better? What is different about the subset of urban, poor, primarily children of color, that is keeping their asthma out of control? I don't know how to make people understand that little things that they do then have this magnified impact on this child who's trying to breathe every day. We have to find a way to make what is a necessity at least safe. Conversations need to start from the people that matter the most, that care the most, and let that voice get louder and louder and louder until it reaches the important places where change can be made.
So I'm a registered nurse, so that's the short answer. But the more complex, the complicated answer, the real answer is that I'm a health navigator. I want my healthcare providers to know that families really are out here doing the best that they can with what they have. There's a traffic light at our front desk, and the traffic light indicates the air quality for the day. So on the days that are code orange, I usually send a notice to the staff management team, and I'll send a note out to the parents. I've got to make sure that all of those kids with asthma have asthma action plans. I've got to make sure that we've got inhalers on site for all of those children, so that when there is a respiratory emergency, we can address it. I can't move the needles on a lot of the social determinants of health. I can't affect the political climate by being Nurse Johnny, but what I can do is help kind of change that trajectory a little bit. Be that person that will come and talk to and listen to families, so that you know that this lived experience is real, raw, and a struggle. So get somebody on your team or find somebody in the community that's doing this work and support that work. Support it some sort of way.
I am a board-certified pediatrician as well as a board-certified allergist and immunologist. We see a lot more allergy here in the Southeast. The lush landscape, you look around and you see nothing but trees, but that also brings, allergies and pollen. So how do you take climate change epidemic and identify it as a causal source or a contributing factor, or is there a test for that? Well, probably not. So you have to be able to listen to your patients and hear their stories and be able to identify what is it in what they're telling you that may point to those things being causal or contributing factors. If we can slow these changes that are inevitably happening to our planet, if we can do things to slow that loop, to decrease the pollution, it just takes a group of people who are passionate I mean, it really does, and it just takes, people to listen and to want to be involved and to, want to be a part of the process.
I heard you say the word hope, and it fills my heart because it can feel that it's in short supply. I'm talking about ways of deeply, strategically, truthfully examining ways in which we are exploiting healthcare professionals, making sure that they have the kind of discretion and autonomy and control that they should. There's trouble brewing, and it's brewing and it's increasing. We're at some kind of explosive turn where I think healthcare is becoming far more curious and even knowledgeable about things beyond the physical body that contributes to health and illness. The unity of the fate of the patient and the fate of the clinician is a place to start thinking.
Hi, I'm Dayna Reggero, and I'm happy to be here today on Children's Environmental Health Day with my very good friend and colleague, Veronica Butcher. Hi, Veronica.
Hey, Dayna.
Thank you so much for joining me for this conversation today about children's health. And it's a big part of a national and international conversation that's happening with the Children's Environmental Health Network today. People can join the conversation at CEH Day hashtag and join us on all of these platforms. We'll be, hopefully down here participating in the conversation if anybody has any questions, but otherwise, let's get started. So now, how are you working, Veronica? How are you involved in children's environmental health?
So I'm director of Mothers for Clean Air, which is a Southeast regional organization working at the intersection of air pollution, climate change, and children's health. I'm based in Raleigh, North Carolina, and I'm a mom myself of an amazing 8-year-old little boy. And we are dedicated to addressing the system change that needs to happen, whether it's within the hospital systems, school systems, or academic institutions, to really see a shift in the Southeast on how we address air pollution and climate change.
Wonderful. And so I have been honored to work with you on this upcoming film, Planet Prescription, that will be coming out on October 20th. So stay tuned for some more information about that. And I know that you just saw some clips, so we want to talk about those as well. And we made those together. And so why are we here on this important day to share all of this information?
Well, we know reducing greenhouse gas emissions improves children's health. There are studies out there. There was a recent one that came out this summer that looked at what's going on in the Northeast, where they have a regional greenhouse gas initiative to reduce greenhouse gases as a Northeast region in the United States. And it showed that lowering air pollution actually has a number of health benefits that start with just in a few years of making the changes of reducing greenhouse gases. And it's because reducing greenhouse gases reduces air pollution. So the study was conducted by the folks at Columbia Center for Children and Environmental Health. They found a drop in asthma, they found a drop in low birth weight, they found a drop in preterm births and autism. And they estimate that the medical cost savings are ranging anywhere from 190 million to 350 million. And that was just looking at 2009 to 2014. But you think about, preventing illness and keeping children healthy, there's also a lot of economic benefit there with, parents not missing work, kids not missing school, things like that. But what's interesting about this study is it actually expanded on a previous study about the health and benefits of Reggie. It's what they call the Regional Greenhouse Gas Initiative, also known as Reggie. And that initial study, they found that there were fewer problems with bronchitis and other common low respiratory illnesses in children. And what we know with air pollution, the PM 2.5, it's particulate matter in the air pollution that can really cause the health problems for children. So because of the intersection of the impacts of air pollution on children's health and the direct correlation with our changing climate and the crisis that we're in now, that's why we're so excited to partner with you to actually hear from the health professionals themselves and hear their voices and their stories, because they're on the front lines of this, crisis in children's health and around the world.
Yeah, I mean, the goal is to be able to breathe clean air, right? And in talking and listening, in filming this documentary, Planet Prescription, we got to meet Dr. Ann, who is an epidemiologist and has worked on these epidemics and pandemics, like the impacts to children's health from air pollution and the climate crisis. I mean, we know what is happening. We know, and people are hurting and people are in crisis. And so the people that are bearing witness to that, when you think about it, we said, who really is able to listen to these stories in a unique way. And that's doctors and nurses and surgeons and health professionals, our counselors, our social workers, therapists. These people have amazing perspective. And so we had an opportunity to go out and film, and the clips that you just saw are just some glimpses, vignettes into some of these voices of people that are seeing the impacts from the air pollution and climate crisis every single day in the many different ways that it presents, and sometimes seemingly unconnected ways. And so that's why we're calling it, it's an unconnected pandemic. And, it can show up in so many different ways. And so some of the clips, are showing different communities. We traveled from North Carolina to Georgia, even stopping in Tennessee for a little while. You got to see Nurse Johnny, who I'm going to start crying talking about Nurse Johnny, Veronica, because she's my hero. All of these people. So yeah, Nurse Johnny is a registered nurse and health navigator. She works in Atlanta, Georgia. You got to see Dr. Cicado, who is a pediatric immunologist and allergist that works in Charlotte, North Carolina. You got to see Dr. Hartley, who's a pulmonologist in Atlanta, Georgia. An internist, Dr. Sharon, who works out of Columbia University in New York, but was attending the Narrative Healthcare Conference in North Carolina. And you got to see also pediatric pulmonologist, Dr. Brooks, who is amazing. All of these people, yeah. And Dr. Ann, of course, another just inspirational human being. An epidemiologist that, of course, also works with Mothers and Others for Clean Air. So
yeah, we're very fortunate to have her as our medical education advisor. And for if folks are interested or would like to have access to her, she has a Ask Dr. Ann column on our website, mothersandothersforcleanair.org. So you can submit any question about air pollution and climate change in children's health, and she's happy to answer them. So she's a treasure trove of information. And for groups that are out there working on these issues, she's also a technical expert. So we just had, we're in the middle of rollbacks or not strengthening rules and ozone. There was a whole bunch of stuff going on around ozone, and she put together this amazing technical document that we were able to share with folks. So she's there as a resource. We hope people will definitely reach out and utilize her.
It's so important to be able to communicate science, to, you know, be able to share that information. She just has this wealth of information and knowledge about climate impacts, air pollution impacts to children's health, and of course to epidemics, and to you know, connecting the dots on climate change so that we can really create solutions for healthy air, for healthy children, and healthy planet, healthy future. So Planet Prescription follows some of those stories, and you know, we'll do the premiere on October 20th, and it will be online, powered by our partners at Seed and Spark. So we're really lucky and honored to be hosting that event there. We'll have the film screening, and it will be the first special premiere viewing of the film. It's a short film, and so you watch the film and then join us afterwards for a very special Q&A panel discussion with the special guest to be announced. So that'll be exciting.
Yeah, we're really excited about the Seed and Spark partnership that you've fostered there. So, and I think it would be awesome to explain to people a little bit about how it's going to work when you click on the film and then get over to the panel, because it's not like a Zoom or a webinar that we're all used to, because the way they're doing the virtual film screenings is evolving, right? So I think for folks in the film community, you all are used to this kind of setting, but for those of us that are used to more like this, it might feel a little different. So can you talk about that for just a little bit?
Yeah, we want to definitely have the screening available online for people to watch for free. And so we'll have that available without a paywall. So you don't need a subscription that's paid to be able to attend this event. This event is for you, you know, it's by us, for us. And so the film will be free. You can go, you can watch the film, and then you join us separately for a live broadcast Q&A. So you'll click over to this other link to be able to join this program that will have all of these doctors. So many of the doctors that you saw in the clips, some other amazing individuals like Tanya Davis, who is a counselor, and other people. So you'll have some other special guests on there. And then of course a host, and it's more of a broadcast. And then we'll be able to save that broadcast too, so that possibly if anybody can't attend on October 20th, of course there will be opportunities to engage with this content afterwards. But this is going to be a big deal. We already have a lot of people RSVP'd, and we haven't even shared it. Like we're just, you know, getting going on all of it. So October 20th, it's a Tuesday, and it'll start at 8 p.m.
Eastern Standard Time.
Yeah, you can sign up on Mothers and Others for cleanair.org.
Yeah, if you go to our homepage, it's right there, right when you come on there, or on any of our social media handles, at Mo Clean Air and on Twitter, and then you can also find us on Facebook. We're very active on those social media channels. And education, you know, making this film was, you know, because one of the big needs we heard in the Southeast was education, right? We're seeing from the American Medical Association a need for education within the medical schools, that, you know, we just haven't been teaching this to our doctors. So, you know, if you think about that, there's doctors practicing now who never learned in school that air pollution is bad for health and bad for children's health and how it manifests. And then when you think about climate change, we're definitely not, I mean, we're not teaching climate change well in most elementary schools. We're definitely not teaching it in medical schools, and the serious health impacts there. So for us, you know, the premiere is the start of a multi-year public education campaign. You know, we're definitely interested in people requesting virtual screenings and partnering with Dayna and I to host us in your state. You know, if we don't talk about these issues and acknowledge that, you know, this is a system change that needs to happen, then we're going to be talking about this in another 5 to 10 years. And I do want to mention, because we haven't said it yet, but, you know, for us, air pollution is an inherent human right. And in the Southeast, the air pollution and climate impacts are disproportionately affecting Black children more so than any other group in the Southeast. And we can say that on a whole nationally. And that's because of the way we have created our country and our cities and our world, with where we site highways, where we build factories, where we put landfills, and oftentimes they're in these more vulnerable communities. And the diesel emissions from school buses is a big thing we're working on. And I know Dr. Brooks tells a very sad story about a child who actually lost his life at school because of diesel bus exposure and asthma. So, as we move forward, education, action, and connecting in the Southeast, that's what we do at Mothers and Others for Clean Air. We can't just talk about these issues. We have to do something about them. And it's time to start to talk about transitioning major vehicle fleets to electric vehicles. So whether it's a hospital's fleet, getting a transition plan going to transition their heavy duty vehicles away from diesel, school buses, definitely we need to start in school districts getting those plans together to transition to electric, because the impact on school scores and children's health, there's a direct connection. And we know this is a man-made problem with a man-made solution. So it's time to act. And we'd love to work with anybody who'd like to use this film as a vehicle to educate, whether it's their school district or hospital, or even universities. There's a lot of work going on at some universities to transition, like at UGA, University of Georgia.
That's so important. That's wonderful, Veronica. Thank you so much for all that you do. Stories can create a healing wave. They can create a wave of impact for change. And the work that you all are doing in the most impacted communities and in children, in the health of children, is so important. You have amazing resources on your website at the Resource Hub that shares all of this information, all of science information about racial justice, is climate justice, is environmental justice, ways that people can educate, advocate, and connect. And you also have, checklist for protecting little lungs, back to school guide for safer cleaning. You've got Dr. Ann there to answer questions. So many amazing resources, and also petitions people can get involved in. What's one way people can take action right now?
Well, first of all, thank you for highlighting all of those. There's something for everyone, whether you're a caretaker of someone suffering from a lung disease, or if you're an academic or health professional, there's something for everyone there. We have 2 action alerts up right now. We have seen over 100 rules and regulations rolled back over the last 4 years by the current federal administration. And that is really bad for children's health, and really bad when we think about what's going on. In the name of COVID, additional rollbacks happen to allow industry to keep going. So we have these hotspots, potential hotspots that are created in some communities where there's more air pollution going. So we've got an action alert to stop the rollbacks on our website. So if you go to our webpage, there's a place to take action. We also have an ongoing campaign that is to tell your elected officials, your decision makers, to act on climate to protect children's health. So that is something you can do anytime, anywhere. They need to hear from us all of the time about this. So please go to our website, take action, it'll send it to your members of Congress, and as well as your state and local officials as well.
I've signed it.
Yay, thank you.
Thank you for all that you do, Veronica Butcher, everybody from Mothers and Others for Clean Air. I'm Dayna Reggero with the Climate Listening Project, and we have a new film coming out called Planet Prescription, coming soon. The premiere date is October 20th, and you can find out more information on mothersandothersforcleanair.org. Right, Veronica? What are some other ways that people can engage with you?
Well, you can sign up for our newsletter, our e-newsletter. We don't send a ton of emails out. So we're not one of those organizations that does what I call rapid response advocacy. We're definitely more education and training. We do send out action alerts from time to time. So sign up to get our updates on email, of course, but then on social media, we're really active there. So encourage you to do that. We will be rolling out more work around electric school buses in the Southeast. So if you're interested in that work, let us know. We also have a developing partnership with Emory University. They have an Air Emory program where we're going to be working over the next couple of years to deploy air sensors across the Southeast. And connect it to the film. So using the film as a way to educate communities about the need for these air sensors, and then working with groups that are already doing citizen science to get these sensors installed in schools, but as well as hopefully our goal, also environmental justice communities in the Southeast. So if you're interested in working with us on that, let me know. We'd love to connect. And Dayna, thank you so much for all your passion and energy on this film. You know, it's crazy that, this idea that we had almost 2 years ago now, and watching it come together, you've done a great job. I'm really excited about the film premiere. And thank you. I should also say thank you to all of our film sponsors. We've had a number of amazing sponsors that help make this happen. And there's opportunity if you're interested in helping sponsor the film as well. That's on the website, and we welcome any support to help taking this to virtual screenings across local communities.
Yeah, we definitely want to continue and provide this as a tool for, impact in local communities throughout the Southeast, or if anybody anywhere wants to use it. Most important thing is just, since starting filming, COVID happened. We want everybody out there to know that, we are honoring you all, and our healthcare professionals and everybody out there that's working together to heal right now, and to fight and be strong, and continue to try to advocate for healing our planet, healing each other. And so thank you all so much for watching us today.
Thank you, Children's Environmental Health Network.
CEH Day. Yes. All right, everybody. Have a great night. Thank you.
Bye.